Hi, welcome to the second video about low back pain. Do you wanna tell me what's happened to your hair? No. Okay, let's talk about more serious things than a hairstyle. Things you cannot choose so easily. I mean, low back pain. Low back pain, yeah. In previous episode I laid out that there are many risk factors which can cause LBP. But in this video, treatments list is much shorter because there is only one treatment, and it is analgesics. Since when we need to address causes of the pain, better ways to reduce the symptoms and pretend that pain thingy never happened. Nope. And that's how you end up with reoccurring problem, year after year. Look, I even created meme for you. Addressing problem by finding the cause of the pain? No. Reducing the symptoms using drugs, lotions, and thinking that pain will disappear eventually. However, we don't live in a perfect world, so what most of us will get is that meme. Before treatments, let's talk about diagnostic procedures. I don't know how things work in your country. Please let me know in the comments down below. But in mine, traumatologists usually x-ray everything and just prescribe painkillers. Even I clearly stated I didn't had any trauma. Maybe it is standard procedure, don't know. And I don't wanna be crying little bee. Procedures like this usually don't do any good, because it does not provide any information about musculoskeletal pain. But what it does, it adds up cost, or even brings unnecessary side effects. Because we need those. We need you. You and you. Usual treatments of LBP are physical therapy, rehab, and spinal manipulation. In addition, there are alternative treatments which can scale down the pain. And at the end, this surgery remains as a final option. But not always outcomes are positive. Without proper physiotherapy, pain comes back as boomerang and hits you hard as hell. Okay, I don't want to go any further, because I could end up in a horny jail. I don't want to be there. To sum up things, I'm going to read part of a study. As the study author states, all patients should be offered with first-line treatment, while some, in addition, will need second-line treatment and few will need third-line treatment. So if you didn't notice, I'm here to help as first-line defense. From LBP, defenders assemble! In the next video we're going to talk about exercise. But before that, we need to make sure that we are on the same page to know why some exercise can be harmful or simply not very effective. Basically, we need to be familiar with structures which compose lower back and how those different systems works together. Anatomical landmarks of lumbar spine starts below 12th thoracic vertebrae with first lumbar vertebrae and ends up with fifth one, which is above sacral spine. So from anthropological perspective, lower back is a region of a body made of 5 lumbar vertebrae, which function is to support load. Besides that, ligaments, muscles wrapping around lumbar spine form natural arch called lordosis, which gives spine stability in walking and lifting weights, and this normal curvature of the back is desired during exercise. Some mix up lordosis with lumbar hyperlordosis, which is excessive over exaggeration of lumbar region. Opposite position named as flat back is also not optional. Axial movements of lumbar spine. In sagittal plane, lumbar spine can move forward into flexion and backwards into extension. Those movements are facilitated by muscles. For example, hip flexors moves pelvis anteriorly, and they are attached to the front of the spine. On the other side, the hip extensors brings hips to posterior position. Those muscles are involved with upward and forward propulsion of the body. The spinal extensors are attached to the back of the spine and can facilitate lumbar extension or hyperextension. Without forward and backward motion, lumbar spine can move sideways in a frontal plane. And in transverse plane, twister option is possible. I mean twister motion, rotation, right rotation and left rotation. Sorry, just kidding. And finally, circumduction is combination of all 4 movements. Here example of clockwise and anti-clockwise. Every healthy person should perform all of those movements daily, because those motions are necessary for joint lubrication, and general usage of those structures promotes spine health. Nonaxial motions of lumbar spine. Lumbar vertebrae also can glide in relationship to each other, forward and backwards, to the sides, and up or down. Most important movement for me is superior glide and traction, because it helps to decompress spine, and I do it every day. And we all know what compression means. We heard that tall people are higher by 2 centimeters in the morning than in the evening. During the day on average gravity wins by that far. It is constant battle. And most of us will lose some centimeters while we age. Just because natural decompression during the sleep is not enough. Thus, I would recommend to learn at least 1 traction exercise. Personally, I've been doing those for past 10 years and never disconnected my vertebrae. Never say never. P.S. Really weird expression. In general, just be cautious. Correct execution is fine and of course beneficial for your lower back. But incorrect form can be detrimental, and here are some risk factors. However, if you are afraid of those exercises, there are more subtle methods. But it requires to spare some money, and are more time demanding. I'm just talking about gravity boots and inversion table. In conclusion, low back is quite complicated system. Pain can be signaled from all tissues. Therefore, patients should be offered with multi-treatment options and be active participants in solving that LBP problem. Okay, thank you for watching this video and maybe see you in the next one. Hang up, bum bum, hang up, bum bum. We are champions, we're not. But still, hang up, bum bum, hang up, bum bum. We are not champions, we are champions, we're not.